Welcome to the Deflux for VUR YouTube channel. I'm Carrie Redd, Training and Education Lead for Palate Life Sciences. Today, we're joined by my friend, Hal Scherz. Hal, as we talk about children who have urinary tract infections, and now a parent suspects their child has a UTI, and they take this child to the pediatrician, what does that visit look like?
Well, Carrie, first of all, I'd like to thank you and for having me and parents tuning into our podcast today. When parents think that their child has a urinary tract infection, the very first thing at the pediatrician that needs to happen is to make the diagnosis. And making the diagnosis will depend on the severity of the symptoms. It will also depend on the age of the child. If you have a child who is experiencing symptoms of a lower urinary tract infection that we've discussed in a previous episode, urgency, frequency, painful urination, that's a child that can urinate in a cup and give a specimen. In a young child who's pre-potty trained, you can put a bag on that child and have them urinate in the bag. A urinalysis will be done initially, and there can be a good idea of whether or not there is an infection going on or not based on that urinalysis. But the diagnosis of a urinary tract infection can only be made on a urine culture that's sent off to the laboratory so that they can see if bacteria grow. They identify the bacteria, and then they determine what antibiotic would be useful to treat that infection. If you have a child who is not sick and you have the luxury of getting the urinalysis and then sending the urine for culture and waiting for the results before you treat, that's preferable rather than starting the child on antibiotics. If there's a mismatch, which very often there is, and by that I mean that the urinalysis may come back normal, and then several days later, the urine culture returns positive for an infection. That is not infrequently a false positive based on the collection method of urinating into a cup and not really giving a good, clean catch specimen in a bag. There's the whole idea of a clean catch specimen in a bag is a myth. And so if there is such a mismatch and the child is still symptomatic, then what I would recommend is to get a repeat urine specimen, this time with a catheter, and then antibiotics can be initiated, awaiting the final result of the culture. And if it turns out that the culture is sensitive, if the bacteria that grew in the culture is sensitive to the antibiotic that was prescribed initially, then it can be continued. If it's not, then it can be switched to the appropriate antibiotic. But it's important not to initiate antibiotics until you are reasonably certain that you're dealing with an infection and the collection method has been reliable, because you only get one chance at being able to make the diagnosis of an infection before you initiate antibiotic therapy. Now, if you have a child who has a fever, that's a different story. And you would want to get a reliable urine specimen right away, because the likelihood that you're going to initiate antibiotics in that setting is pretty high. So you want to go right to a catheterized specimen, get the most reliable specimen that you can get. The child will get started on antibiotics, as I've indicated, and then we'll await the final urine culture and determine what the bacteria was and whether or not the child is on the appropriate treatment.
Great, thanks. All right, so now it's determined a child has a UTI, and then what happens next?
Well, Carrie, again, urinary tract infection, as we've said on previous in a previous podcast, is a generic term. So if we're talking about a cystitis or a lower tract infection, an infection that's not associated with a fever, it's reasonable to simply get an idea of whether or not there's something that we should know about in the urinary tract, get a broad overview of what's going on. And that's best done by simply getting a sonogram or an ultrasound of the kidneys and the bladder. And if that's all normal, then we don't need to go any further based on just one infection without fever. A urinary tract infection with fever, on the other hand, pyelonephritis, a kidney infection, warrants a more in-depth evaluation of the urinary tract. And that means sending the child to the radiology department, not only for an ultrasound of the kidneys and bladder, but also a test called a VCUG, or voiding cystourethrogram. And that involves the passage of a catheter, a urethral catheter, filling the bladder with contrast or X-ray dye. And then the radiologist takes pictures as the child is undergoing the study, as the bladder is filled, and then as the child is urinating the contrast material out of the bladder. And this is an important test that we order to make sure that there's not an anatomic problem that is present that might explain a urinary tract infection. In boys, they can have a problem in the urethra that could cause infections. They can have a urethral stricture or other problems involving the urethra. But the most common problem that we see in children that's associated with urinary tract infections involving fever is a condition called vesicoureteral reflux, which is when the urine travels back from the bladder up to the kidneys. And that's the most common anatomic problem that we see in association with urinary tract infections involving fever.
Well, that leads to another question then. Now we have a child who's had a diagnosis of a UTI. Now they've had a study with radiology that determines, that they may have vesicoureteral reflux. And now begs the question, is this something that should be managed by the child's, primary care pediatrician, or should the child be referred to a specialist? What do they do?
There are a lot of pediatricians who feel comfortable managing problems in the urinary tract, especially mild cases of reflux. It's never wrong to involve a specialist in the care of a child who's been diagnosed with a urinary tract infection. And that's because not all infections are necessarily easy to manage. And when a child has had one infection, it's very likely that they'll have more infections. And so the reason for the infection is much more important than the diagnosis of the infection itself. And we want to try to prevent further infections in the children, which is a problem for the children, of course, and it's a problem for the parents. And so involving a pediatric urologist, somebody who is specifically trained in the genitourinary problems that children have, is a very reasonable way to go. And the pediatric urologist understands all of the problems that affect the urinary tract in children and can come up with a treatment plan that the primary care doctor can be part of, and the management of these children can be jointly done.
Well, Hal, thank you. That answers a lot of questions for our inquisitive parents and caregivers out there who've been generous enough to watch our Deflux for VUR YouTube channel. And I'd ask our audience to join us for future episodes where we'll talk to Dr. Scherz about more specifically about what a pediatric urologist is, and also about how to manage vesicoureteral reflux. And we look forward to seeing you then. Thanks for joining us.